Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. Today we're going to talk about things that people do that maybe not seem really normal, but they do them. You have little attitudes toward eating certain things. For example, this is a cookie. And the cookie is good. I love cookies. And they're crunchy. And a lot of times folks like crunchy things. We don't know why. They like peanuts. They like all these kind of popcorn. As long as they got something to crunch, and it's kind of grinded between their teeth and things like this. Of course, this will cause you to have, it might not have anemia or anything like that, but it could possibly cause you to lead on to diabetes and things if you eat too many of these kind of things, like a cookie. But in the South, years ago, people ate things that were crunchy also, and it was clay. And clay now won't give you diabetes, but it will give you iron deficiency anemia. And of course, they liked it when it was crushed, broken up like this so they could put it in their mouth and chew it. And that gave them satisfaction. But they would eat a lot a day, sometimes a pound, or more than a pound of this stuff a day, which caused iron deficiency anemia. Well, at Downstate Medical Center here, we have a professor who's very interested in this whole thing of Argo laundry starch and did a project on it that wanted to make it more available, the information more available to the public as such, how this all took place. And so we have Julie Black-Pert, the professor here at Downstate Medical Center, and she's going to give us a little discussion about what this is iron deficiency anemia is all about by eating products like clay in the South. I want to welcome you, Ms. Pert.
Thank you so much for having me.
Yes, I'm so glad you picked up on this because it's so often we have two people working in the same place where they both become interested in this kind of information.
Well, I take great pleasure in getting an opportunity to expand on this particular project with you. The last time that we met, we touched on it a little bit, and that's where my interest was piqued, and I decided to go ahead and do a little bit more. In my research, I found that back in 1963, when you were still a resident in Kings County Hospital, you stepped into the waiting room and you encountered a young lady sitting there eating chunks of starch out of a brown paper bag.
Right.
Tell us a little bit more about that experience and how that got you on the track to this very near and dear to you project.
Surely. Well, this is the starch that the folks were eating at that particular time is called Argo laundry starch. It's simulated. It was chunky. In fact, when people went into grocery stores, they would go into the confectionery area because that's where they kept it at, rather than in the laundry area.
Yes. Because
they knew the people were going to go to that area to get it, to have something to grind in their mouth that was tasteless, but causing a lot of problems. I got very interested in it because I used to see folks sitting in the obstetrics clinic eating laundry starch. But they wouldn't have it in the blue box like this. They would have it in a paper bag.
Yes.
But there was evidence around their mouth it was white.
Yes.
And of course, this was an evidence that they were taking something out of that bag that was causing a problem. Now, during pregnancy, of course, you should have a hemoglobin about 14. They had hemoglobins, which I'll get into, of 7. That's the quantity of iron in the blood and things like this. But what this material was doing was chelating or joining up with the iron, and the iron was coming out in the stool, rather than being absorbed into the body to produce.
If I might, this was something that I was going to ask you to expand on a little bit. Exactly how is it that this particular product does affect the body and cause the anemia? We do know, and you mentioned it in the introduction of the show, that the iron deficiency anemia causes something called pica or pica, and it's spelled P-I-C-A. A lot of people are not aware of it, but what happens is we understand that these women would be eating unusual things like clay, like chalk, right?
Oh, yeah,
yes, which is very common, even when you go talk about our young people, adolescents and children.
Cassava, that's from the West Indies and things like that, surely.
And that this kind of began with the slaves when they were brought over to the South, that they brought this tradition along with them, and they would eat clay, and it didn't have to be just any old kind of clay.
Right,
It had to
right.
be a particular clay, and that the tradition got carried on in the southern states, and women were doing things like baking it, I understand, and
Surely.
seasoning it with a little bit of vinegar,
Right, surely,
and,
surely.
and bringing this tradition alongside.
Yes.
Of course, continuing to eat it became something that caused them the anemia, and you talk about chelating, and basically that is binding up
Right, surely,
that
surely.
hemoglobin. The hemoglobin for our studio audience is something that carries the oxygen around in our blood,
Right,
and it's
surely.
attached to those red blood cells
That's
in
right,
our
surely.
blood, right? And when we don't have enough hemoglobin, we're not getting enough oxygen, and therefore
really-
there are other problems. Expand
yes.
on it a little
yeah,
bit.
well, sure, because one of the big things in eating clay in slavery was how to commit suicide, because if your hemoglobin, which is the amount of red blood that's in your body with a lot of iron, that should be around 14, when they ate that, the iron was not present, and so they became anemic. So they experienced dizziness, weakness,
Yes.
or hallucinations, all kinds of maladies. In fact, their jaws would swell up here because the parotid glands had to pump out more fluid because it became so dry that
Yes.
the parotid glands actually stood out of their neck like this. They used to just glands right underneath here, and of course, that caused her a lot of problems with their saliva and things like that. So their mouth was always dry, very dry. And of course, they couldn't go out in the field to work because each plantation had a doctor assigned to it. Slavery was not just having to work and do slave work all the time, but they paid a lot of money for the slave.
Yes.
That slave had to work 14, 16 hours a
Yes.
day. If they ate clay, they could not go out in that field.
Right, they weren't productive.
weren't productive.
Yes.
So consequently, one doctor who had did an autopsy on a slave that ate clay said that the blood that was running through the right underneath the conjunctiva here became milky white, and that's why you could tell a lot of times whether you have
they were
anemic.
doing anemia.
If you just do this, and it looks like very
Yes,
pale,
pale,
that means you have
right.
anemia. Oh, you can even look at the
It's a nail beds,
nails,
yes.
nail beds, but even more so, the lines in your hand. These lines in the hand become non-existent.
Yes, and these patients also can experience some severe gastrointestinal problems.
Oh,
they
sure.
have concentration problems,
Yes.
things other than just those particular, and fatigue.
Well,
fatigue
fatigue, sure.
is a big one, and they not able to be productive in the field if they're tired.
Yeah.
I want to just expand a little
surely.
bit on something when you mentioned about being dry. On this little pamphlet that you had at the time, it says here that laundry starch will make you feel rough dried.
Rough dried,
okay?
yes.
So, and it also says if you eat laundry starch, you'll become a stiff. Expand on those two things a little bit.
Yeah, and a rough dried clothing is when you wash your clothes and it becomes rough.
Yes.
And it dried, you know what I mean? And you have to press it at that time. So it means that you have to really press it out and so forth. It's rough, it's dried, and you feel you're rough dried. You're all wrinkled up rather than being stretched out, you know, as such. And the other point was,
Oh, the other point was, let's just get it verbatim.
Sure,
Laundry
yes, sir.
starch will make
stiff.
you a stiff,
Yeah, well-
become a stiff.
Well,
Yeah.
well, more or less, it can lead to death, early death, of course. And like I said, it was used in slavery to commit suicide. So it makes you stiff. When you're dead, you're stiff.
Yes, almost definitely.
So you look in the casket and that's a stiff.
I certainly wasn't thinking that far down the road when I read that particular comment, but it does make a lot of sense.
Yes.
And this, of course, is very important for people to know about today, because although, thanks in great part to you and your campaign on this particular matter, we've been able to get this particular problem out of the way.
That's right,
We
sure,
do
yeah.
know that eventually the Argo Starch company, and it wasn't just them, although
right.
they were vehemently denying the fact that people were eating as much of their starch product as you said that they were, that it wasn't just Argo, but other starch companies that were doing it. And then it originally wasn't manufactured just for laundry.
That's right.
Their claim, if I'm understanding it correctly, is that they were manufacturing the product for food consumption because people use starch to make certain foods,
right.
and that pretty much people were using it for laundry as well, and that
Yeah.
they didn't have anything to do with why people were eating it in such abundance.
Surely.
So what I was thinking about segueing over to now is talking about how you ended up getting a wonderful gentleman, a television gentleman, Mr. Bill McCreary,
Right, surely.
how he ended up getting involved, because I know you pulled him in, or he saw something. How did he get involved? Tell us a little bit about that.
The main television show we had in those days was called Black News.
Yes.
And Bill McCreary was the sponsor of that show and so forth. It was on Channel 5, you know. And I went to him and I told him about the problem. And at first, he was not really understood the whole thing, but he and his producer said, well, let's take a further look at it. So we went into stores where with the cameras and so forth. And number one, we found that we asked the proprietor of the store, what do people do with Argo Starch? And they could hardly speak English. They said, they eat it.
And that's the first thing that they said was that they eat it instead of using it for laundry.
For laundry,
and it says Argo Laundry Starch.
That's right, yeah. So they eat it. Furthermore, we took the camera and shot it where it was in the store. And it was never in the laundry area. It was always in the confectionery area of cookies and things like that. So the people would just get their box of starch for 50 cents, 75 cents, which was maybe worth a nickel or 5 cents to produce as such. So it was a big profit motive in that for them to eat it as such. And of course, right away you saw, and the proprietor of the store would kind of laugh. But they didn't know why they ate it, but I certainly knew that there was something going on here from other studies that I had done.
Right,
you know,
they didn't understand the history.
The history of it. But as soon as they found out, they would put it in the laundry area. See, the box itself, it wasn't sanitized or anything. It was like a cardboard box where people would just take shovels and walk in rubber boots and just put it in benders and it go into a box. So it wasn't sanitized. So it had a lot of things like rat hairs and a lot of other stuff in it too, germs and things like that. So it was more than just a product producing iron deficiency anemia, but other germs getting into the intestinal tract, because you know when you have even in big sugar mills and things like that, rats run all through these things.
That explains something for me, because in my research about this particular product, I saw where they say that they manufactured it for eating purposes, and then they have this other one for laundry.
Right.
So the one that was manufactured for eating purposes obviously was processed differently.
Right. Oh yes.
Okay. So
it was
that
in a yellow box.
Yeah,
the same Argo Starch was in a yellow box that people used to thicken their gravies with.
Right.
But that was sanitized. It was in a package.
Right.
And it was
Had to be.
packaged. But here you were producing a stuff that you knew people were eating. But it wasn't sanitized.
Right.
You know what I mean? So that's consequently, you can imagine, even in the big wheat bins and so forth, rats, for example, in milk, they count how much bacteria is in milk, you know, and they say you can have a certain amount. You have a certain amount, but you not too much, you know. However, we don't know what that little bit is doing either.
Yeah,
but
know? We were talking about Bill McCreary. I'm sorry, we digressed a little tiny bit. Let's get back to Bill McCreary and how he got involved.
Sure. Well, Bill McCreary saw a problem, and I proved it to him that it was a problem by taking him to the stores and things like this. And he took it on. We shot about 23 shows on this. Now, it's very important to realize that African Americans were not into a lot of television in those days from the standpoint of health issues. In fact, Bill McCreary chose me as being the first black physician to ever be on television on a regular basis. It was never done before. And if you look at today, you see very few black male physicians on television. And of course, when you're going toward a certain audience, it would seemingly be important to have someone that they can identify with to say this is taking place in your community. And it has happened because we went on from 87 to 97, 10 straight years, where we shot over 600 shows, not only on Argo Starch, but on other health issues that affected black folks.
Right.
You know, and other people too, because other people used to copy our program and extend on it on CBS and these other shows even.
Right.
You know.
So what my understanding is that through the work that you did, along with the help of Mr. Bill McCreary, eventually the Argo Starch Company changed the labeling to say not recommended for food consumption. Now, were you satisfied with that?
No, not really, because basically cigarettes could have also can cause lung cancer.
Yes.
You know, I mean, that doesn't stop people from smoking, of course, you know. it was the drive that people had to chew this material and swallow it. That was the thing. So I wanted to get it from this form into a powder form,
Okay.
or as such, but not clay as such, but the chunky starch.
The chunky stuff, yeah.
The chunky starch. And as soon as that happened, the consumption of it was cut away almost immediately because people couldn't find it. You know?
So that's eventually what ended up happening.
Yes.
You put out this campaign, they put on the labeling first, and then the next step was for them to go and change the formulation of the product from chunk to flake, and that really did help a lot. And so subsequently you were helping with that.
Sure.
All right, so further down the line, this whole campaign gets a lot of recognition,
Right, sure.
and I understand that you received a commendation, and I believe, correct me if I'm wrong, I think in 1978, a letter was sent to Bill McCreary's office where his show was on airing, stating that, and if you could, we can read it if you have it here.
Well, the thing is that
that's great.
One thing that happened was the Department of Health and Human Services down in Washington's Food and Drug Administration actually called us up to present an award in Washington to us for this particular work, investigative reporting. The sad part of it was that even Channel 5, where Bill McCreary was at, never recognized the significance of investigative reporting on his part.
Okay.
And that was never recognized,
That's
which
sad.
is really sad also because everything is put in different categories. Look like when we were in science, we have to have just a different category. But he was never given the full.
Let's if you might, let's go ahead and just read this. Of course, Department of Health and Human Services, Public Health Service, Food and Drug Administration. This certificate is presented to Gerald W. Deas in appreciation for the educational, informational efforts performed in making consumers aware of the dangers of ingesting laundry starch and getting industry to voluntarily put a warning label on this product in New York City, conducted at Adam Clayton Powell Jr. State Office Building, January 24, 1985.
Right, yeah.
And this is a major milestone because once again we talk about it wasn't just Argo Starch, it was other companies that ended up having to also follow suit in order to help to put this problem to bed.
Right. Well, you know, another thing was that helped also was Gary Null on WBAI. When I approached him with this, because I was doing a show on BAI also, so he invited me to come down and do a show, and we did a show on this, and it actually burned out, because it's a call-in show, it burned out the lines coming into WBAI.
Oh boy!
On the people that related to this whole thing. That's how important it was. And Gary Null was not just an ethnic show or anything. He's a Caucasian, wonderful investigator and things like this. But you can see black people listening to that particular show, and of course, they just burned out the lines. And he said he never had that many calls in that particular hour ever in a show.
That just goes to show you the impact of it. Because with tradition over the years, when women weren't able to get clay, and when they moved to the United States and they didn't have clay, they transitioned from the clay to the starch because it was the closest thing that they could get to the clay that they used to eat. And even though the problem's been belayed, nowadays you still do have some women, I imagine, who are older and still chomping on
something. Right. But you know, and it's a fact though that there are so many health issues that we have not. Clay not only removed our iron, but it was removing magnesium and all the trace elements. Now let me explain that to you because it's extremely important that our magnesium is essential for control of blood pressure. When you're magnesium deficient, your blood pressure will go up. And of course, we have malignant hypertension. Black folks had tremendous hypertension. So here it was not only solving a problem of anemia, it was actually solving the problem that we had to gear them toward, when you take something out, you have to put something in.
Yes.
So basically we had shows, I did shows on magnesium. We had no drugs for hypertension until 1955 in the world. No drugs for hypertension until 1955.
I didn't know that.
Yes, and the first drug that came on the market was hydrochlorothiazide, you know.
A diuretic.
But black folks was doing this. When their head would pump, and they knew, they call it pressure, they would take Epsom salts
Yes.
and grapefruit juice. Now, Epsom salts is magnesium sulfate, pure magnesium sulfate, and their head would come down. Magnesium is so important in our diet for heart irritabilities and things like this that we were doing more. Although we were after iron, we were also solving a problem of magnesium, you know what I mean? And so here this is serving, it goes across the board that when you're doing something, it's not just a one thing.
Yeah, so you took care of two major health concerns, particularly amongst the African American population. Now, I'm just wondering, this mostly has been geared towards women, but were there also men that were eating the clay in the laundry?
No.
I guess they weren't doing the laundry, so they weren't.
well, not only that, it didn't have the same, it seems like it was a female thing, because even in Africa, I had a friend traveling through different parts of Africa, the men would make clay like this in kind of like a little smooth thing. They showed me the little, like almost like a mold. And he would sell it to the women for a penny a piece.
Oh, so they were profiting from this. They were profiting
off the women too.
Oh,
you know what I mean? And so they were actually producing it right there in Africa, but not realizing that these women had anemia. And you know, when you look at it sometime, see when they got in roots, Haley showed when they dug a well and they got to the clay, they saved that for women.
Oh, okay.
Down in the earth. Now women use it as a magical thing because they would spread it clay on their face. You've seen the African things and so forth. So it's a whole thing that nobody was really understanding ethnicity of disease. And I think that this is where we're missing the boat. Even in hypertension today, the drugs they have in hypertension, black folks do not respond as well.
No, they don't.
And so they're trying to make a patent drug for black people because they're finding out the drugs, these beta blockers and all these things are not working well,
as well.
You see?
And it's unfortunate because most African Americans now cannot be controlled on just one medication alone.
They're putting two or three.
Two or three, this polypharmacy that we're needing because compliance is always an issue. Getting people to understand. That's why we call diseases like hypertension silent killers, because people feel fine. They don't realize what's going on inside of their bodies. There are things and symptoms that they might not see or feel, but when they come to the doctor's office, if they go to the doctor's office, which is another issue that we're catching, and then we're trying to explain to them the importance of following through with medications and regular follow-up, exercise, diet control, working on the epidemic of obesity. We could go on for days with various different topics on health-related,
Well, even the fact that when you even take a diuretic now, diuretics works very well in African Americans.
Yes, they do.
The hydrochlorothiazide. They find that's one of the foremost drugs that they found that would bring down the pressure. But hydrochlorothiazide also wastes a lot of minerals.
We have to work with potassium.
Potassium, but more so magnesium. You can become hypomagnesemia, they call it, low magnesium. When that happens, the heart, instead of pumping like this, it starts trembling, like that because of a magnesium deficiency. But just think of all the other things in the marketplace that we take for granted that are nutritious and things like this. They say, well, eat 10 vegetables a day, you know, but nobody's eating 10 vegetables a day. But they're eating a lot of other stuff that's causing the blood pressure to shoot up, particularly sodium.
Yes, salty foods, a lot of fast foods, people not preparing meals. And then on the other side of the coin, you do see some response from the food industry where they're trying to find fancy ways to get people to get all of their vegetables and fruits in by combining them in various drinks and things like that. So
which are expensive.
Very expensive. So then now you're placing them out of the reach of people because there's always a financial component. And we can look at this at from various different variables of why people are not well and taking care of themselves in
Sure.
terms of the nutritional needs.
Sure. Well, Dr. Pratt, also, it's extremely important that people even know that it's sodium, not just salt. You know, people get this thing, well, table salt. Table salt is sodium chloride, but you have in soda sodium benzoate,
Yes.
you have sodium bicarbonate, you have sodium,
different types.
all the different types of sodium. So anything that has sodium attached to it can be a problem.
Right. Sodium is in things like soda and soft drinks.
Sure.
People don't
Sodium
realize.
benzoate.
Yes, and
It's
we have
sodium.
to really start to watch that. So as we start to wrap up, is there any particular advice that you would like to share with particularly women, or tell people what they need to look for today if they feel like they may have a family member or themselves may be suffering from anemia, and what are we using currently to treat that?
Yeah, right. Well, certainly iron deficiency anemia still persists in our communities
Yes, it
because
does.
of the fast food industries and things like this. But what we really need, we have to have more African American professionals such as yourself to bring the message to the people, because basically it's more realized and more appropriate sometimes to approach our own problems and things like this. So I think the program you're having today just brings this out in the way you were able to get it all together and let folks know that sodium is important, magnesium is important, and all the other things are important.
Well, I thank you very much, and we certainly encourage everyone out there to go to their doctor if they're feeling, or they know somebody who's eating chalk or unusual substances, that this is definitely a sign of iron deficiency anemia. And once again, I just have to say thank you very much for having me and allowing me to interview you, our illustrious host, about a substance and something that's very near and dear to you, and we need to know more about it. Thank you, Dr. Deas.
Thank you very much.
All right then.